Welcome to the deep dive. You've shared a medical chapter on the musculoskeletal system, and our mission today is really to give you the core understanding.
Mhm.
How your bones, joints, muscles, how they're assessed, and what changes you might expect through life.
Exactly. Think of it like a shortcut to understanding what doctors are actually looking for during an exam.
Right. So we're drawing from Chapter 23, Musculoskeletal System.
Yeah, hitting the key points on physical exams and how this whole system evolves from babies right up to older age. It's quite the journey.
Okay, let's jump in. When a medical professional is physically checking you out, palpation, right? What are they feeling for?
Palpation, yeah. It's all
Yes.
about touch. So normally you shouldn't feel any tenderness when they press.
Okay.
No swelling, no warmth, and definitely no grating sounds with movement. We call that crepitus.
Crepitus, right. Heard that term.
Yeah. So what flags an issue is, well, pain, obviously. Swelling, heat, any kind of lump or mass,
Mm.
or if movement is limited or something just looks off, deformed. That's the abnormal stuff.
Got it. Gives you a baseline. Now, joints, I guess we're not all built with the same kind of connections.
Not at all, no. Think of it in the sort of three levels of movement. You've got synovial joints. They're the freely movable ones.
Like shoulders, knees.
Exactly. Shoulders, knees, fingers. They have this fluid-filled space that allows for, big range of motion.
Okay.
Then there are cartilaginous joints. They allow some movement, just a bit. Think of the vertebrae in your spine.
Ah, so they have a little give.
Just a little give, cushioned by cartilage. And finally, fibrous joints. These are the immovable ones,
Immovable, like where?
like the sutures holding your skull plates together. They're built for strength and stability, not movement. Each type is perfectly designed for its role, really.
That makes sense. Different jobs, different joints. Okay, what about those movement terms? Flexion, extension. Sounds complicated.
It can sound it, but it's pretty simple if you break it down. Flexion is just bending a joint, like making a fist or bending your elbow.
Okay.
Extension is the opposite, straightening it out, releasing that fist, straightening your arm.
Right,
Then abduction.
right.
That's moving a limb away from the center line of your body, like raising your arm out to the side,
Oh, wait, okay. So adduction is,
bringing it back towards the midline, having it back to the body, you could say.
nice way to remember it. What else?
Rotation is turning your head side to side. Circumduction is making a circle, like swinging your arm all the way around.
Okay.
And then you have some specific ones for, say, the forearm. Palm up is supination, palm down is pronation.
Supple, right. Supination.
Uh-huh. Yeah, if that helps. And for the foot, turn the sole inwards is inversion, outwards is eversion. Knowing these just helps describe movement clearly.
Definitely useful. Okay, let's talk spine. It's not just one long bone, is it?
Oh, absolutely not. It's a complex column. It's divided into regions. 7 cervical vertebrae in your neck, C1 to C7.
Neck. Okay.
Then 12 thoracic vertebrae in the upper and mid back. These are the ones your ribs attach to.
T1 to T12. Gotcha.
Then 5 lumbar vertebrae in the lower back, L1 to L5. They carry a lot of the body's weight.
Yeah, you feel it there sometimes.
You do. Below that is the sacrum, which is actually 5 vertebrae fused together, forming the back of the pelvis. And right at the bottom, the coccyx, or tailbone, usually 4 fused vertebrae.
Wow. Okay. So knowing those sections helps pinpoint issues, I guess.
Precisely. A problem in the lumbar spine feels very different and has different implications than one in the cervical spine.
Makes sense. So how does all this change across a lifespan? What's typical?
Ah, yeah, that's really interesting. As we get older, bone density tends to decrease naturally. This increases the risk for osteoporosis, so it's something to be aware of.
Bones get more brittle.
Essentially, yes. Joints might feel stiffer, movement can become a bit slower,
Yeah.
and some older adults might develop kyphosis, that's a forward rounding of the upper back.
Okay. What about, say, pregnancy?
Pregnancy brings its own changes. Hormones increase joint mobility, which can be necessary but sometimes causes discomfort.
Yeah.
You often see lordosis.
Lordosis.
Yeah, an increased inward curve of the lower back to compensate for the baby's weight. And sometimes a sort of waddling gait because the pelvic joints are more relaxed.
Natural adaptations, then.
Exactly. And even from birth, there are checks. For infants, specific tests like the Ortolani and Barlow maneuvers look for hip dysplasia. A newborn spine is naturally C-shaped and flexible. Symmetrical movement is key.
Fascinating how it adapts. Lastly, muscles. How are they checked out? It's not just about size, right?
Definitely not just size, although size is important. We look for atrophy, which is muscle wasting, but also strength. It's usually graded on a scale, 0 to 5.
0 being no contraction, 5 being full strength.
Exactly. Then there's muscle tone. Is it normal? Or is it too tight, which we call spastic, or too loose, kind of floppy, that's flaccid.
Spastic flaccid.
Okay, and crucially, symmetry. Comparing the muscles on both sides of the body. Are they equal in size, strength, and tone? It all gives a picture of muscle health and nerve function.
Right. So covering all that, palpation, the different joints, ROM, the spine structure, life changes, muscle checks, it paints a much clearer picture of how the musculoskeletal system is viewed.
It really does. You get a sense of the complexity, but also the logic behind the assessments.
So the key takeaway is understanding this baseline assessment and how things normally change over time.
Precisely. And, thinking about all that, especially the age-related changes, like the decrease in bone density, maybe joints getting stiffer, it brings up a really interesting question, doesn't it?
Which is,
Well, what proactive steps could someone actually take now, regardless of their age, to support their long-term musculoskeletal health, to maintain mobility and function down the line?
that's a really good point. Definitely something for our listener to think about. What can you do today for your bones and joints of tomorrow?
Yeah, worth considering.